Pregnancy stresses a woman's heart and circulatory system. Even if she is in great health, it can really happen to anybody who's pregnant. My guests know about this. This is one of their specialties, and my guests are Dr. Connie Graves and Dr. Stacy Davis. Thank you both so much for coming in today.
You're welcome.
On a hectic day for you both. Tell us a little bit about the Perinatal Cardiac Center at St. Thomas and what kind of patients you see.
So we started this center in 2015. And it was in response actually to the American Heart Association's mandate that women with preeclampsia have follow-up. And I thought, well, how will anybody ever do that unless we start a center? And in that we decided that we would see people preconception, women with heart problems or history of heart problems who are thinking of getting pregnant. We would see women during the pregnancy, and then we would follow those women postpartum. In addition, we would see those women who are at risk for heart disease later in life, including patients with a history of preeclampsia during a current pregnancy, hypertension, or diabetes.
Okay, so Dr. Davis, how does pregnancy affect the heart?
Pregnancy has a lot of effects on the heart. The number one effect is that when you're pregnant, the amount of blood circulating in the system increases significantly, and that can lead to increased swelling. Your heart has to work harder during pregnancy, so if your heart has to work harder and you have an underlying heart condition, it can tax the system. It can cause high blood pressure. There are a whole bunch of things it can do, and that's why it's so important for a woman to get close prenatal and postnatal care, especially if they have a known heart condition.
Okay, and again, even if you're fit,
it
can happen.
Yes, because preeclampsia occurs in about 6 to 10% of all pregnancies. Often, besides the fact you may have a family history of high blood pressure or underlying heart disease, that may be your only history. So, and it's usually a disease of first pregnancies. So you won't even know that you have any risk factors until you're well into the pregnancy.
Oh my, all right. So what complications appear to be linked to heart disease? Either one of you, whoever wants to answer that.
Well, some of the things in pregnancy that are linked to heart disease are preterm labor, intrauterine growth restriction, where the baby is small and doesn't grow well, preeclampsia that we've already talked about, gestational diabetes, and interestingly, stillbirth can all be linked to the possibility of developing heart disease in the future.
That was my next question. So what about later in life? So these pregnancy complications could lead to future cardiovascular problems?
Exactly. So preeclampsia has been associated with increased risk of stroke and also subsequent heart disease, blocks in arteries. Many individuals we found who have preeclampsia, they may have clotting abnormalities, they may have abnormal cholesterol, and left untreated, the effects on the heart can be significant. They can lead to heart attacks and other complications. And it's not uncommon, we have found, for women, once they get in that window between childbearing and menopause, they may not see an OBGYN or a general internist for many years until an event such as a heart attack happens. So we want to increase awareness of women. We want them to take charge, know what puts them at risk for heart disease, and act now when they can prevent heart disease.
Do you find that some of this information is surprising to some of the women who come in first time?
Well, what I think is surprising to everyone is that cardiovascular disease is the #1 killer of women. Not just women who are menopausal. It is the #1 killer of women in pregnancy. It is the leading cause of maternal mortality. In pregnancy.
My goodness, how frightening. So what if you get pregnant after you've been diagnosed with some type of heart abnormality or experienced a heart attack? Then what?
Then you need to see both a cardiologist and a maternal fetal medicine specialist who will work closely to help care for you, because we can get you through your pregnancy, and our job is to make sure that you do well and your baby does well. You require more attention than the average woman who's pregnant.
More frequent appointments.
More frequent appointments. And keep in mind that some of the congenital heart problems, such as valvular problems or things of that nature, may also be reflected in the baby. So that not only does the mother need follow-up, but the fetus needs to be seen, needs to be have good ultrasound and be scanned by someone who's skilled in taking a look for these abnormal fetal heart conditions.
What are some of the things that the mom, the pregnant woman, could do to make the pregnancy healthier for her and for her baby? What are some of the things that you advise them on, as far as, is it diet, is it exercise, or is it more medication?
It's actually starts preconception. If you're thinking of getting pregnant and you know that you have a heart condition, before you get pregnant, go see a maternal fetal specialist and or go see a cardiologist who specializes in this to help you assess your risk and to help you reduce your risk. Often we will tell patients, listen, if you're going to get pregnant, get your diabetes under control, get your blood pressure under control, lose weight. And we will often have them meet with Dr. Graves and her team so that they can advise the woman about her risks, not only to herself, but to her fetus, so that she can do everything possible to stay healthy.
And you can have healthy outcomes if you just go along with what you're being advised and you make those appointments, and you can have very healthy outcomes for both you and the baby.
That is correct. And keep in mind that most cardiac medications, with a few exceptions, are still safe in pregnancy.
They are still safe.
And so often we will even initiate medications to make sure that you are able to get through the pregnancy without complication.
All right, thank you so much. This is so enlightening. I know you've opened a new center. You're excited about that.
Yes, well, we are opening a new center, and Dr. Davis and I are available for patients to see us, and we also work in conjunction with St. Thomas and the maternity program there, which is set up to uniquely care for these women.
Thank you. We're lucky to have you in our community. Thank you both so much for
Thank
coming
you.
in. And thank you for watching Community Health Matters. Learn more ways to improve your health on our website, mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.